Hi, this is Dr. Paul, and thanks for tuning in to yet another video from Waterfront Dentistry by Paul's. Today I'd like to talk to you about gum disease. Gum disease or gingivitis is the infection of the gum or gingiva, which is this tissue covering the bone where the tooth is lodged into. Periodontitis is the infection of the bone which is caused from gingivitis. So just to put things in perspective, all gingivitis doesn't cause periodontitis, but all periodontitis is eventually a consequence of gingivitis. I hope that isn't too confusing. Now, there are certain kinds of bacteria in your mouth that causes gingivitis. Interestingly, the bacteria that causes bone loss and gum disease is different from the bacteria that causes decay of your teeth. That's very, very important for you to understand, because there are certain groups of people that are very prone to decay, but their gums and bones are in immaculate condition, and vice versa. The human immune system is very interesting because not only does it ward away infections, and not only does it kill bacteria that causes a majority of infections, but also it affects the tissue cells by collateral damage. This is also one of the reasons why some people who don't really brush, floss, and have really bad oral hygiene don't end up having a lot of gum and bone loss. It's because their immune system is strong enough to keep the bacteria at bay, but also doesn't cause a lot of reactionary destruction of their own tissues. But some people who don't have a lot of plaque and whose oral hygiene isn't terrible end up getting a lot of gum and bone loss just because their immune system is very overzealous and destroys a lot of their own host tissues. This is why the immune system is sometimes looked at as a double-edged sword. A lot of times your hygienist might tell you, look, you've been coming here quite often, but I think you need to go and see a specialist. And this is because even with regular cleanings and maintenance, your gums are always unhealthy. It might be a lot useful to go and see the specialist, because the specialist might have different approaches as far as surgeries go to contain a lot of situations so that things aren't getting from bad to worse under supervision. This is basically very frustrating for us as dentists and hygienists, because no matter how well we are trying to improve your health, we're still not succeeding, and that's why we want to refer you to a specialist. There's a lot of literature and science out there that if you have a chronic infection of your gums and bones, you're at a higher risk of getting cardiovascular diseases, stroke, and even affecting the birth of babies for mothers with gum and bone disease. There is a lot of science to this, and although not proved or proven directly, this is basically because of an enzyme called C-reactive protein. When you have a lot of chronic infections, you have a high buildup of C-reactive proteins, which eventually causes, consequentially, all these kinds of immune-related problems. I hope this video has helped demystify some of the questions that you've had in your mind regarding gum loss, gum disease, and bone loss. If you do have any questions, please reach out to our office, ask our hygienist, and we can definitely try to help you with this. Thank you so much for watching.